Pravastatin sodium is a medication that is used to help lower bad cholesterol and fats in the blood, while also raising good cholesterol. It is often prescribed along with a proper diet to reduce the risk of heart disease and prevent strokes and heart attacks. This medication works by reducing the amount of cholesterol produced by the liver. It is important to maintain a healthy lifestyle, including eating a low cholesterol/low fat diet, exercising, losing weight if needed, and quitting smoking, to ensure that pravastatin sodium is effective. Be sure to consult with your doctor for more information on how to best incorporate this medication into your daily routine. When taking pravastatin sodium, it's important to follow your doctor's instructions. You can take it with or without food, usually once a day. The dosage will depend on your medical condition, age, and how you respond to the treatment, so make sure to inform your doctor about any other medications you are taking. If you are also taking other medications to lower your cholesterol, such as bile acid-binding resins, take pravastatin at least 1 hour before or 4 hours after taking these other medications to avoid any interactions. To get the most benefit from pravastatin, take it regularly at the same time each day, even if you feel well. It's important to continue following your doctor's advice on diet and exercise while taking this medication. It may take up to 4 weeks before you see the full benefits of pravastatin sodium. If you are prescribed pravastatin, it's because your doctor believes that the benefits outweigh the potential side effects. Most people who take this medication do not experience serious side effects. In rare cases, pravastatin may cause mild memory problems or confusion. If you experience these effects, speak with your doctor. There is also a rare possibility that statins, including pravastatin, may lead to or worsen diabetes. It's important to discuss the potential benefits and risks with your doctor. In even rarer cases, pravastatin may cause muscle problems, which can lead to serious conditions like rhabdomyolysis and autoimmune myopathy. If you experience muscle pain, weakness, or signs of kidney problems during treatment, make sure to inform your doctor immediately. Liver problems are also a rare possibility with this medication. If you notice symptoms such as nausea, vomiting, yellowing of the skin or eyes, dark urine, or abdominal pain, contact your doctor right away. While serious allergic reactions to pravastatin are rare, it's important to seek medical help if you experience symptoms such as rash, swelling, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other unusual symptoms, contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking pravastatin, it's important to tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so be sure to discuss this with your healthcare provider. It's also important to inform your doctor or pharmacist about your medical history, especially if you have liver disease, kidney disease, or if you use alcohol. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's recommended to limit alcoholic beverages while taking pravastatin, as daily use of alcohol may increase the risk for liver problems, especially when combined with this medication. Older adults may be more sensitive to the side effects of pravastatin, especially muscle problems. If you are pregnant, pravastatin should only be used when clearly needed, as it may harm an unborn baby. It's important to discuss the risks and benefits with your doctor. This medication can pass into breast milk and may have undesirable effects on a nursing infant, so it's best to avoid breastfeeding while using pravastatin. Be sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with pravastatin sodium. Certain medications and herbal products may affect how pravastatin works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with pravastatin sodium include colchicine, daptomycin, and gemfibrozil. Also, It's important to avoid taking any red yeast rice products while you are taking Pravastatin Sodium, as some of these products may contain a statin called Pravastatin. Taking Pravastatin and red yeast rice products together can increase the risk of serious muscle and liver problems. If someone has taken too much Pravastatin Sodium and is experiencing severe symptoms such as fainting or difficulty breathing, it's important to call 911 immediately. Otherwise, you can contact a poison control center for assistance. In the U.S., you can reach your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share Pravastatin Sodium with others. While taking this medication, you may need to have lab or medical tests done to monitor your blood cholesterol and triglyceride levels, as well as your liver function. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Pravastatin Sodium, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It's important to store Pravastatin Sodium at room temperature, away from light and moisture. Avoid storing it in the bathroom, and be sure to keep all medications out of reach of children and pets. When it comes to getting rid of this medication, never flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly dispose of the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.